At least a full answer. Okay. So last, which was the remedy we spoke? Aconite. Okay. Any big questions in Aconite? Anything you would like to ask? Nothing? All clear in Aconite? Okay. So, as a small recap, key points of Aconite. Tensions, okay. So, what is it? Fear. Okay, there's a lot of fear. Yeah, see, when you talk of, symptoms, or when you talk of PQRS, one thing is that suddenness. Suddenness, the violent symptoms, they are very, very important in Aconite. Okay, good. Suddenness, they are very violent. And Aconite has a lot of fear, lot of anxiety. That we have discussed in length. What is the fear, what is the anxiety? Okay. Then what else? Shock, a very good remedy for shock. Okay. Shock, then. Shock again which comes sudden. Death, okay. No problem. See now, apart from the mind, the mental symptoms, we also have few characteristic symptoms in Aconite. Hemorrhagic remedy, very good. Type of pain. Yeah, type of pain in Aconite was stinging, tearing, burning. Okay. Stinging also reminds us another remedy, and that remedy is apacin. Very good. Okay, apacin. Apacin also had stinging pains. Good. This is, yeah, 1 second. It's a thirsty remedy. Thirsty remedy. Thirst for large quantity and large intervals. So this was again a peculiar symptom in Aconite. Okay. See, we did compare remedies like bryonia, we compared remedies like arsenic, remedies like gelsemium. Okay. We have done that already. Anything else in Aconite? First stage of inflammation. Very good. And many fevers in Aconite, it was the result of first stage of inflammation. Okay, pneumonia or tonsillitis. So any pathology which is early and you have a fever related to that, and fever is high, fever is sudden, you can think of Aconite. Good. Anything else? Yeah, there is sensitiveness. Okay, good. Sensitiveness. What else? Suppressed? Yeah, very good. Important point. There is retention or suppressed urine. What was the cause given? It could be out of shock, it could be out of fear. A newborn baby, there will be retention of urine. 8 hours, 10 hours, 12 hours, 1 day, the child may not pass urine. And great stalwarts have seen a dose of Aconite can bring in free flow of urine. Very important remedy. Otherwise, in allopathy, they usually put catheter so that the retained urine comes out. So in this given case, when it is sudden, Aconite can do wonders without the catheter. Okay. Anything else? Abortions. What was the cause for abortion that we discussed? Fear. And what is the type of abortion we have in Aconite? Very good. Threatened. See, somebody in your OBG class, they might tell you in detail about abortions, type of abortions. I will not touch that area, but having used the word threatened, you also have to remember that there is only a fear of abortion happening. A lady might have a slight bleeding, and it might give us an indication that she might abort. But if a remedy like Aconite or any other remedy is indicated correctly, abortion may not happen. It's only the threat. So threatened abortion. Many times a case of threatened abortion, if they are treated correctly, the mother will continue with her pregnancy and she will also deliver normal babies. Normal baby. Okay. So that was about Aconite. See, now we will talk of a similar remedy. When I say similar remedy, a remedy which is again a short-acting remedy. And hopefully, if everything goes well, we'll try to finish this remedy. So whenever you talk of fever, I just wanted to make it more practical. There are a lot of patients who come to our clinic. Okay? So when you look at those patients, we have basically two categories of people coming to us. Or people coming to us with two categories of diseases. One is what we call it as an acute disease. And the other one is what we call it as a chronic disease. Okay? In your organa, they will tell you more in detail. But having used the word acute, what do you mean by acute? Something that is sudden. Something that is sudden. And what is that is chronic? Chronic will be for a longer duration. Okay? I'll just share a small case here. And this case has got nothing to do with the remedy I'm going to do. But I just want to give you an example for what I mean by acute. Okay? Yesterday evening, we had a gentleman who had come to clinic. He had bad pain in the chest, in the epigastrium, and he had bad burping. Okay? Acute gastritis. I've already used the word acute gastritis. Meaning what? It was sudden. It was sudden. So in homeopathy, when we deal with acute problems, we have a simple formula. Okay? When you deal with chronic problems, we have a different formula. So when it is an acute case, I know it's too early to ask a second year student, but I'm very optimistic and I'm asking you this question. How do you go ahead? You have a gentleman age 40-45 with severe gastric pain. Okay, he's got burps, he's not able to eat. Okay, he's in a very difficult state, meaning he's not able to do his routine. Simple case. Now, how do we solve this case? Appendix. What is very beautiful. One of your friend very nicely says exciting cause. Aphorism number? Just say this. Aphorism number? 5. Okay. All your senses should be alert. Aphorism number 5. Dr. Haniman there, he uses the word exciting cause. Good. What do you mean by exciting cause? Very good. Which triggers. Beautiful. For a second year student, I am mega impressed. Good. So apply this to your case. See, now this is very important. What you study theoretically has to be applied. Now you apply this. How do you question him? What do you ask him? Okay, very good. What do you eat? Beautiful, good. Then anything beyond that you can think of? You need to be a little loud because my ears are plugged. Okay? Yeah, one of your friends very confidently said, what did you eat? Is eating the only exciting cause? No. So what other exciting causes can you think of?
Any habits?
Okay, any habits? See, habits should have been there for so many days. But why now? Did you change your brand? Is that the question? Okay. Chalo. Could be. Habits, food. When I use the word beyond, what is it that I am expecting? Very good. Beyond physical things. So your friend said mental. Who is a mental? Or what is it that you want from the mental side or the emotional side? Very good, I am very happy. Must be during my second year days, I was not as smart as you guys are. I am happy, good. So you think of some physical changes, change in the brand or change in the food, or ultimately you come to this point. Was there anything emotional that disturbed you? Good. We have 3 things. So you asked for food. What did the person say? Sir, there was no change in food. And you asked for the brand. Sorry sir, I have never used any brand. Why? It's not at all alcoholic, no tobacco, no gutka, no smoking. So this is ruled out, food is ruled out. Now we come to the emotion. Now what is emotion? Okay, chalo, no issues, good. At least emotions, there is something called as fear. See, what happens? See the kind of confidence you get when you study homeopathy. Done? And And you will be studying it a little later. When it is GI, what you need to ask. Okay, in GI we don't ask for fear. We ask for fear when it is asthma, when it is lungs getting affected. When it is GI, what is the direct question we ask? I am giving it very early to you. There should be some anger which is suppressed. Okay? Fine? There should be some anger which is suppressed. Okay? So now, how do you put this question? It shows how confident you are. So what is the question you ask? I mean, you have this simple way of asking, you had any emotional upset? One question. So what will the majority of the patients tell? No. No. And you should see the frown, you should see their face, they'll make you feel like a fool. What questions you are asking? I have come for gastritis. So what is one way of questioning? You had any emotional issues? Did you have any emotional issues? Is the question you are asking. What is the better way of questioning? What emotional issues you had? Simple for a secondary student. So when you are using this, what emotional issues you had, and did you have an emotional issue, you see the difference in questioning? You are getting this clear? Or you have a third thing, we ask a question, and what is that question? What situation happened where you became angry and you could not express your anger? So this will take some time for you to get into that kind of a confidence. Okay. So what had happened here is, I asked him the third question. So what situation happened where you are angry and you are not able to show your anger? Straight question. Right? Okay? Many times they may say, nothing doctor. But then you tell, no, there is something. The confidence with which he is telling there is nothing, the similar confidence you are telling, no, there is something. Right? You are getting it? And in between sometimes wife would have accompanied. She will be the bridge in between us. And she will look at you, look at him, and then she says, yeah doctor, you are right. Something happened. So luckily same situation. Yesterday wife had accompanied. And the gentleman was saying nothing. Wife said, no, there is something. So what is that something? My daughter got the results. Right? Not my daughter. The patient's daughter got her results. And he had expected, he is a teacher, and he had expected good results. Unfortunately, she did not get good results. So, come on. Everybody will get angry. All your father, when you went with less marks, they got angry. There are so many fathers they would have got. Good, you at least got 70. I got only 40. Good, very good. Keep it up. There could be fathers like them also. Right? And somebody would have felt very sad. Somebody would have felt angry. Right? Somebody would have started belting. Yeah, remove the belt and I did so much for you and this is what you are giving me back. Take this back. Right? So, I mean, it could be a situation. But what was the feeling this gentleman had? Unfortunately, what did I tell you? What did I use the word? He himself is a teacher. He himself is a teacher. So the issues he had was, sir, I teach thousands of students. And those thousands of students have got very good marks. Now, if somebody asks me, how much mark your daughter got? How much percentage your daughter got? With what thing can I show or can I tell them this is the marks my daughter had? Daughter got 1. And in the bargain, he also got very angry. Fine? And I asked him, why did you not show your anger? Sir, how can I show my anger? She is a elderly girl, second PhD. If I show anger, and in return if she does something to herself, that is more dangerous. So what are the two things you are getting in this patient? He is suppressing his anger, good, very good. And second very important thing, what is happening? Okay, more than fear. See, because of that fear, he did not express anger. What is the other emotion that came out? How will I show? How will I tell? Everybody, this is the marks my daughter has got. So somewhere, he also felt insulted. You getting my point? Okay? And after that incident, here, it has started burning. Shiruva. Dakar, not able to eat, not able to push food inside. So this is how he typically came to me in the evening, to my clinic. Okay. So there is a remedy, beautiful remedy in your Materia Medica. Must be if you were in third year, I am sure I would have heard a big noise, loud noise about the remedy that I prescribed. But please do remember the remedy that I prescribed him was Staphylococcus aureus. Don't forget, Staphylococcus aureus is a remedy which has lost a lot of esteem, self-pride. And Staphylococcus aureus is also too dignified to fight back. So they will suppress their anger. Two key points of Staphylococcus aureus. And one dose of Staphylococcus aureus, and 8:39 I get a WhatsApp message. What is the WhatsApp message? What is the WhatsApp message? Thank you so much, doctor. I am feeling much better. I could eat my dinner. Done? And what is it? The common complaint, common problem many of us have. Homeopathy is slow. How slow can homeopathy be? 1.5 hours. He gives you a feedback. He thanks many of them, they don't do. Great man. Yes, thank and send me a WhatsApp message. Fine. So what I am trying to tell you or motivate you students is, if we prescribe a remedy correctly, it can do wonders. So we get basically two types of cases. One is an acute case and the other one is a chronic case. See, can I get some quick examples for acute cases? I have already written one. For example, fever, cough, cold, headache. Headache could be acute, headache could be chronic. Throat pain, body pain. Simple examples. So when you have something like this, so we go for beautiful, I am very happy, we go for the exciting cause. Right? Here we don't take the details. We don't sit for 2 hours and take all the details. It will be very minimum 5 minutes, 10 minutes, 15 minutes. What happened? And Dr. Hahnemann says, we take an acute totality. We take an acute totality and we prescribe. Okay. So my question, the remedy I am going to discuss today is a remedy which is predominantly indicated for fever. And it is an acute remedy and it is a short-acting remedy. Right? Okay. So now to make this class more interactive, post-lunch class. Okay. What remedies as a second year student you have in your mind for fever? Very good, opponent. Sudden comes the answer. Good, opponent. Huh? Epis. You have told or I am telling? A very good epis. See, when you answer what I have done, I also feel a little relieved. Good. Opponent epis. Very good, bulimia. Good. Any other remedy? Huh? Very good. Be loud. Arsenic. One of your friend is telling arsenic on our foot. Very good, beautiful. Shayad Anpo list. Good, response. Huh? Good, Baptisia, beautiful. Good, then at least one more remedy you can think of, or two more remedies you can think of. Huh? Better? Okay, good, no issues. It's not there in second year, so I was a little worried. Okay, good, belladonna. Ferrophos, chalo. Huh? Allium cepa is an acute remedy. But do you see fever in allium cepa? No issues, no issues. I have written two things. Hope that was confusing. We are talking of probable remedies for fever. Okay. Any other remedies that you can think of? Who was that? Good, Jalsine. One more remedy. One more remedy, simple remedy. A remedy for intermittent fever. Good, Syncona, China. Okay, chalo. Chalo, China, chalo. Okay, chalo. Okay, so these are all the remedies that you can think of, you can recall. I'm very happy, good, keep it up. Now we'll talk about Baptisia. And once I finish Baptisia, it's a short remedy. We will also try to understand how to differentiate the other remedies from Baptisia. Okay. One more remedy is missing. Somebody quickly. One more remedy which is done. which is also a very good remedy for fever. Huh? Ethusa. Drosera, no issues. Not Drosera, not Ethusa. Okay, we'll come back. Okay. So what I was trying to tell you here is, we'll discuss a very simple remedy called Baptisia. Okay. So now what do you have in Baptisia? See, Baptisia is a remedy, which mainly acts on blood. Okay. So I am talking to you about the sphere of action, and we'll also look at the pathogenesis. Baptisia is a remedy acting on blood. Acting on blood, what will Baptisia do? Okay, it will cause disorganization of blood. So if you look at the pathology, what is happening? The end product of pathology here is, it is causing septicemia. Okay, the blood is getting disintegrated, that is getting infected, and the ultimate thing what you have in Baptisia is, it is causing septicemia. Now what is septicemia? Okay, when you have infection in the blood. Okay, when you have bacteria or when you have infection in the blood. So septicemia. A second thing, it also acts on the mucous membrane. It acts on the mucous membrane and it will cause ulceration. It will cause ulceration. Okay. See, when I say septic condition, okay, for a second year student, from the knowledge of your bacteriology, one condition that will come up here is typhoid. Okay? So which is the organism? Salmonella typhi. This you would have already studied in your bacteriology. Is it done? Okay, no issue. Somebody will do or you study. That's not our botheration today. So Salmonella typhi is what causes typhoid as a second year student. Now we will try to understand tomorrow in our clinic, when we have a patient coming to us with typhoid fever, when do we think of Baptisia? That is the whole and sole aim of today's class. Okay? I am mainly focusing on the typhoid symptoms of Baptisia. Yes? We'll go stepwise. Now, many of you would have suffered typhoid. Many of you would have had typhoid. Okay? So what are all the common symptoms of typhoid? Very good. There is weakness. There is fever. There is vomiting. There is chills. Good. Body pain. Very good. Diarrhea. Loose stools. Abdominal discomfort. Okay. Loss of taste. Fine. And obviously face looks pale, weak, all. These are all common symptoms of typhoid. Okay. So now we will try to understand what symptoms we have in Baptisia. Okay. I was referring Dr. E.A. Farrington's clinical materia medica. Just make a note. Beautiful materia medica. Written by a great author, Dr. E.A. Farrington. If you are very keen about homeopathy, you need to study this book. Very nice book. Clinical Materia Medica by E.A. Farrington. So according to this gentleman, he explains, okay, the indications of Baptisia during first week and the indications of Baptisia in typhoid during second week. This is how he explains. So first week, as many of you told, there will be body pain, there will be weakness, abdominal discomfort, the abdominal muscles will feel sore, and there is diarrhea. Okay? And he also describes the tongue, which is generally yellowish. Whitish, and slowly at the end of first week it turns yellowish. So this is what you have in the first week of typhoid, the symptoms in Baptisia. So what are the symptoms? Common symptoms like body pain, muscles paining, abdominal discomfort, tongue coated white septic conditions in the blood increases. Okay? As the bacteria in the blood increases, well, in the second week, what symptoms do you see? Okay? Now what Dr. Vijayakrishna says is, slowly the weakness might increase. Okay? He becomes very tired, bad muscular pains. Okay? And any part of the bed he is lying down, he feels the bed is hard. Which is the other remedy? Arnica. That is the remedy I wanted for typhoid. Arnica. We'll compare. So, what is happening in baptisia? So, body pains, body feels sore, and any part he is lying down, he feels that part is hard. That part is hard. The tongue, which was white, yellow, will become brownish. Okay? Dirty brownish coating of the tongue. And there will be a lot of ulcers. And teeth. You will have some brownish crust formation. Brownish crust formation on the teeth or brownish crust formation on the lips. Okay? Now this is what medically we call it as sores. S-O-R-D-E-S. Sores. Which generally happens in long-lasting diseases like typhoid. So there will be accumulation on the teeth and lips, and very offensive. Very offensive. At this stage, I also want to introduce you another very important point of baptisia, and what is that? It is one of the trios of offensive remedies. Any discharge. Okay. For example, what do I mean by any discharge? Saliva, very good. Sweating, good. Urine, stool, okay. Breath, phlegm, everything in baptisia will be highly offensive. When they are talking, bad breath, fine. So, one of the trios of offensive remedies, very important. Which are the other two? Huh? No problem. It's not sulfur, it's not calcarea, no issues. Dr. Nash, trios of offensive remedies. No issues. We have creosote and mursote, the other two. And the third one we just saw was baptisia. Okay? What is it? Mursote and creosote. Creosote. K-R-E-O-S, creosote. Okay. Anyway, we'll discuss that later. So, what I was trying to tell you is the typhoid symptoms, very bad weakness, very bad tiredness. Tongue, how is it now? Brown. And then there are ulcers over the tongue, bad breath. And if you look deep inside, bad sore throat. Okay, there is sore throat. And he is not able to swallow. He can swallow only liquids. Liquids is what he can only swallow. Done? He can't swallow solids, meaning rice, roti, chapati, all those stuff is not able to swallow. Like tender coconut, water, liquid juice is able to swallow. Tonsils are swollen, tonsils are inflamed. And lower down, if you look into the stomach, the symptoms are, there is nausea, there is vomiting, and the abdominal muscles are all very sore and very painful. Please remember all the keywords, and before we close the class, we will try to compare with similar remedies so that you understand baptisia better. Okay, so what I was trying to tell you is the abdomen which is sore and the stools. Okay, what is the character of stools? Stools can be yellowish, greenish, but what is very important? Stools are very, very offensive. Highly offensive stools, watery stools, bad debility, bad weakness. Okay, this is what you will be seeing in the typhoid symptoms. There will be chills, okay, chills followed by heat. And during heat, the entire body feels very, very hot. Then you are sweating, again the sweat is very offensive. Sweat is very offensive. High grade fever, okay? Then high grade fever, urine and all other the discharges are offensive. Now, something I missed here is what is the emotional state of a person, of a Baptisia person in typhoid. Okay? See, Baptisia acting on mind, it will cause excitement. It increases the activity of mind. So what you do or what you see in Baptisia is, in the mental state, they go into something, what we call it as delirium. Okay? Any other remedies that we spoke? Better delirium? Very good. What was that? Good. What happens in Ethusa and delirium? Good. Loud. See, answer is right. You need to be loud. Good. I like this speed. Whenever any question is asked, you should all be like opponent. Sudden. Don't be violent. But you need to be sudden. You need to be quick, fast. Good. Happy. Ethusa. Yeah, as if cat, as if rats are running under the chair. This is the delirium, Ethusa. Okay? Yeah, who's the Narnika? Yeah, what happens Narnika? Good.
We'll answer the question and
Very good, beautiful. There is a comparison here. Arnika will answer the question correctly and then goes back to sleep. Good. So here what is happening? Here in delirium, fine? He will not answer your question completely. In between answering, he will go back to sleep. You are getting my point? So fever since how many days, what complaints you have is a question you ask. So you might say, sir, I have body pain, I am feeling weak, and then sleeping. Then again, boss, what happened? Sir, yeah. But what will Anika do? Pain. Like for example, yes, I have got body pain, I have got this, that. He will answer your question and then he will return to stupor. Okay. So this is the basic difference between Arnika and Baptisia. Fine. See, these are all very important observations. Okay. It is happening in front of you. You are attending a fever patient is in delirium. How is he reacting? Is he Arnika? Is he Baptisia? Is he Brayania? Is he Arnika? Or is he Ethusa? We don't know. But only if you know what symptoms those remedies have, you will be in a position to differentiate. Otherwise, he will be doing something which you feel is irrelevant because we don't have that knowledge. Okay? The patient will be telling, Mom, come, we'll go home, we will go home. Or he's doing something, he's talking too much, he's crying, he's holding the mother tight. Those are the symptoms that you need to observe. Fine? And you also need to understand that those things are there in our materia medica. And we'll have to prescribe the remedy. Okay? Okay. So, in delirium, what is happening here? First point. What is happening? He is answering your question halfway and is going back to sleep. Are you all clear with this? Okay. Second important point here is, he feels his body is scattered. I'll repeat this. He feels, what is the Baptisia patient feeling in the delirium? He is feeling his body is scattered. His body is scattered. Leg, hand, this, that, it's all scattered. And you will be surprised. Great homeopaths explain that the person will be busy fixing his leg. Oh, my leg is there. You please come here. My hand is there. Oh, this is my hand. He's busy doing all that. And many times in typhoid, you see that his sleep is disturbed. Why is his sleep disturbed? Can you sleep? Can you have a sound sleep if your leg is there, your hand is there, your parts are all scattered? Can you sleep? Same thing is happening with Baptisia. Sir, my leg is somewhere there, my hand is there, how can I sleep? I can't sleep. So he is busy scattering them. Or he feels one leg is talking to the other leg. You are getting my point? Yeah. Now why is all these things happening? Because the mind is excited and they are in a delirious state because of fever, they are in a delirious state. And each patient in delirium, they have their own way of reacting. This is what I want you to understand. And this is how Baptisia is going to react in delirium. How is he going to react? He answers your question halfway and he goes back to sleep. One probability. Second thing is, he feels his body parts are scattered. And third thing, he is busy collecting all of them. And he might also feel that one part is talking to the other part. So when one part is talking to the other part, how can I sleep? Fine. I am not at peace. My one leg is talking to the other leg. My one leg is asking the other hand, how are you? And my other hand is answering, boss, I am feeling tired. So how can I sleep? So this is what is going to happen in Baptisia. Very important. Any questions at this stage? Typhoid is what they often ask in your exams. Okay? And you should remember all these things. Body pain, temperature, offensive discharges, okay? Then bed feeling hard, okay? And then vomiting, nausea, loose stools, offensive loose stools, pain abdomen, soreness, every muscle pains in Baptisia, you need to remember. And that septic condition, ulcers in the mouth, ulcers in the intestine. What is the complication of typhoid? What will happen? Intestinal perforation, very good. Pace patch, if you remember, that gets affected. Okay. Intestinal perforation or intestinal ulcerations as a result of typhoid. You know, they are all there in Baptisia. Okay. So if you understand typhoid from your bacteriology, and then if you read typhoid symptoms of Baptisia, you will know what is common and what is uncommon. In typhoid that you study in your bacteriology, they will not talk of delirium. You getting my point? They may talk to you about sores, they may talk to you about diarrhea, they may talk to you about a lot of other things. But how the diarrhea will be there in each remedy will be different. What is the word or Hahnemann uses? Individualization. How you individualize a remedy in a common condition typhoid becomes very important. Please don't prescribe blindly every case of typhoid Baptisia. It will not work. Why will not work? Simile plus purine. Okay, you will have to do the matching. If the case of staphylococcus that I shared, if I have not matched correctly, and if I have not given staphylococcus, and if I had given some other remedy, Naxwamika, arsenic, do you think you would have had a relief like that? Sir, you would have matched, telling, no, I had function food, I had spicy food. So what would have I given? I would have given him Naxwamika. Or I ate outside food, something happened, I would have given him arsenic Kambal. Do you think I would have got a message 1.5 hours after arsenic Kambal? No. Because that case was not arsenic. That case was not Naxwamika. That case was staphylococcus. And that's why staphylococcus could give you that instant relief. Our remedies are very fast. We need to be smart. We need to be fast. And people who feel bad, sir, मेरे को MBBS करना था. I have come here, and what is this? Please consider yourself blessed. Fine? And trust me, it is 100 times more difficult than allopathy. If some of you feel what homeopathy, it is so easy, take back. You please go to MBBS. That is easy. Homeopathy is tough. Don't take it for granted. Fine? Allopathy is easy. Allopathy is easy. I tell you, once you go to KC General, I have my interns who come to me, and they go to KCG. And within a week they feel fed up. Sir, एक antibiotic, एक painkiller, एक antacid, एक multivitamin. Right? Antibiotics आप सुस्त हो जाएंगे, एक multivitamin ले लो, एंटीबायोटिक से आपको जलन होगा, एक एंटासिड ले लो, 4-5, एक हफ्ते में you get bugged. But homeopathy is not like that. Every case is challenging. Every case is new. I did not expect to give him stephysagria to that gentleman. I am going with the case repeatedly because that's the kick you get in a clinic. Right? There's nothing that is routine. Fever, you have a prescription beforehand, allopathy. For the doctor is seeing the typist nose, she would have taken and kept the prescription ready. Yeah, homeopathy में ऐसा नहीं होता. Fine. You have to be very, very, very careful. Every fever case is different. क्यों आया, कैसा आया, क्या कर रहे हो आप fever में? This is something challenging. And if you are not for challenging, and if you are not for challenges, homeopathy is not for you. Fine. Please quit, join MBBS. और एक बात लिखो, चलो, no issues. But this is a beautiful science, and not everybody can practice. Then you need a lot of dedication. And once you dedicate and once you practice homeopathy, the height where it takes you is a different level. But you need to work hard. Then, and nothing will come easy. Even if you do MBBS, you need to be smart, you need to work hard. Just because you're MBBS, nobody will come. At least BHMS, somebody will come. Only MBBS, no. We want specialist, super specialist. Fine? मेरे को इधर दर्द हो रहा है, so they go to the doctor who is specialist here. Fine? Okay? Done? That is how it is advanced. Done? Any system has its own flaws, its own limitations. Fine? So our scope starts where allopathic scope ends. It's a beautiful science. Consider yourself blessed and please focus on homeopathy. Okay? So we'll get back. What I was trying to tell you here is a beautiful remedy for typhoid. Not for all cases of typhoid. Baptisia has its own symptoms. Now we'll try to compare few remedies, then you'll understand how Baptisia is different. Okay. Now before I finish with Baptisia, there is also a symptom, I read in Baptisia, abortion, miscarriage, threatened abortion. We are talking of which are the other remedies for abortions? Only account? Which is other remedy? Abortions. Yeah, very good. Abortions in abyss when first trimester, third month, okay, first 3 months. Abyss mellifica, beautiful. You also have opponent. Now I am also introducing you to Baptisia. Okay, abortions which comes from listening to bad news. Abortions from mental excitement. 2 causes in Baptisia for abortions. What is it? One is mental excitement and the second thing is listening to bad news. Okay, abortions. Fine. And septicemia. Okay. Like there is something called as puerperal fever. Puerperium is a period after delivery. So during that time, if they have fever, you can also think of Baptisia. Okay. Any quick questions in Baptisia, typhoid? Because at least in this class for second years, they are mainly focusing on typhoid. Okay. Any quick questions? If you have nothing to ask, which of the remedies you feel is relevant to be compared with Baptisia? I talk of only those remedies. Which are the remedies? Okay, we'll take a break here. Good. We'll do this. Typhoid. Okay, Arnika, where is this? Arnika. Okay. Yeah, here, Arnika. China. What is the type of fever you have in China? China is more for malaria. China is more for intermittent fever rather than typhoid. Okay, fine. Okay, at least in today's class will not disturb China much. Okay, any other remedies you feel is relevant to be compared? Very good response. Good. See now this itself shows how well you are oriented. I'm happy, good. You are picking up right remedies. Good, I'm happy. Bryonia, Restox, Arnica. Any other remedies you would like to pick it up? Should we compare it with Apis? No. At least for today's class, no. Why? Apis is again more of an intermittent fever. Okay. So we are not discussing Apis. We will not discuss China today. Anyway, this we will not for time being. It also has symptoms. You can also discuss arsenic. Okay. And you can also discuss gelsemia. Okay. Now, which remedy you want to discuss or compare first? Restox. Okay, no issues. Boys hardly have the voice. One of the boys is Restox. Good. Now, you have the question here. Is Restox done? No. Okay. Then why you wanted Restox? Okay, must be you wanted to know more about Restox. We'll take it that way. But then you can't contribute anything. Okay. I'll make things simple. In Restox, what you need to understand is there is more restlessness. Restox also has body pain. Okay? Restox will have more of restlessness. Fine? The other, for example, Baptisia also feels bed is hard and he keeps moving. Okay? But restlessness is more and more prominent in Restox. And Restox has ailments like getting wet, complaints, and complaints which comes after overexertion. These things can happen in Restox. Bad body pains, pains better by movement, and very restless. Okay, that is Restox. And what was the term we spoke in Baptisia? Tongue, which is white, yellow, brown. And the tongue in Restox is more red triangular tip. The tongue, okay, this part is red triangular tip. Okay, this is Restox. Now, better remedy? Bryonia, okay, good. Now, quickly, how is Bryonia different from Baptisia? Very good. Now, one of your friends wants me to compare the Delirium. The Delirium in Baptisia is 3, we spoke of. One was? Answers? Half-frame goes back to sleep. Beautiful, good. One, second? Fifth part is scattered. And third? One part is talking to the other part. Good. Please do remember these 3 delirious state in Baptisia. We will now come back to the delirium in Bryonia. How is it? What is it? What will the Bryonia patient tell in delirium? He wants to go home. Good. He wants to go home. Please remember, this is how patient comes. And it is so bad in Bryonia, he will be in his own house. He will be sleeping on his own bed, but he will be telling his mom, I will go home, we'll go home. Now that is Bryonia. Okay? And Bryonia is slow. What is the onset in Bryonia? Gradual. And in Baptisia, the onset is rapid. The onset is rapid. Symptoms very fast. They keep spreading. Spreading means the pathology will be going more deeper and deeper very fast in Baptisia. In Bryonia, it is slow, gradual onset. 3 days pehle, you would have had ice cream, and after 3 days, you might start with mild body pain. That's how it is also different from aconite. Aconite, you eat ice cream, you pay, you finish, fine, or you might start nose irritation, you might start body pain, you start feeling uncomfortable. That is aconite. See the suddenness. Fine. So in Bryonia, body pains are there, myalgia is there is more of delirium, and Bryonia is a hot patient. And how is Bryonia different from Restox? Yeah, no. Restox is more restless. And how is Bryonia? How does Bryonia sleep? Anybody who has studied Bryonia in Kent, what does Dr. Kent says about Bryonia? They sleep like a log. No place to write anyway. They sleep like a log. What is log? Log is a huge wooden which you can't move and you can't shake. They sleep like a log. Very difficult for you to, wake up a brain patient. They sleep like that. Okay, it sleeps like that. So bryonia will have more of constipation. And what did Baptisia have? Baptisia has more of diarrhea. So that rapidity, that delirium, okay, that sleeping, Baptisia is restless. He feels bed is hard. But how is bryonia feeling? He is comfortable. He is sleeping well. That is bryonia. Okay. So the other remedy we can talk of here is arnica. How is it in arnica?
Answers completely.
Huh?
Answer completely.
And very good, answers completely and goes back to sleep. What is common between Baptisia and arnica is they both feel bed is hard. They both feel the bed is hard. Okay? Fine? Okay? The stupor, Dr. Vijayakrishna says, the stupor in arnica is too much. To the extent they have no control over urine and stool. Okay? Involuntary passing of urine, involuntary passing of stool. Severe body pains. Okay? Done? So these things is what you have in arnica. Huh? Clear? Now another remedy is Delirium. Delirium comes very close to Baptisia. What are the similarities? The muscle pains. The muscle pains. Bad muscle pains. Okay? What is the difference between Delirium and Baptisia? Again, in Delirium it is not rapid. It is slow onset. The symptoms are not so exaggerated like Baptisia. In Baptisia, it is more rapid. It is more rapid. In Delirium, body pains, they want to lie down. Weakness. Okay. One very important thing in Delirium is eyeballs feel very heavy. And an intelligent homeopath, the moment the Delirium patient enters, they can make out his Delirium. There will be drooping of eyelids. There will be drooping of eyelids. Eyelids will be very, very heavy. With a lot of difficulty, they are keeping their eyes open. It's all, falling like this. They come to you in this state only, to clinic. That is Delirium. Chilly patient, chills runs down the spine. Thirstless. And none of these remedies had offensiveness like Baptisia. The only remedy which comes very close here is arnica. Arnica will have offensive stools. Okay? Arnica will have more of offensive stools. One last remedy before I close is arsenic. Okay? Now what is common? Is arsenic done for you? If it is not done, somebody will do, but do remember, arsenic will also have offensiveness. Like Baptisia. Arsenic is more restless. There is a lot of anxiety in arsenic, which is missing in Baptisia. Lot of anxiety. What will happen? What next? Why I am suffering so much? They are so anxious. Anxiety, restlessness, that cadaverous smelling discharges. Okay? Prostration, weakness. Thus for small quantities. Sips of water. They all come under arsenic. Okay? We also have belladonna, we also have lacasis, we have many more remedies. Muriatic acid, a lot of other remedies having typhoid. But I just limit to the remedies that are there in your syllabus, so that the comparison should not add to your confusion. Okay? Done? So we have 2 more minutes. What is it that we try to do today? A quick recall. We spoke of Baptisia. And the only point we try to highlight in Baptisia is we try to explain the entire Baptisia under typhoid. We explain the mind, dullness, delirious state, okay? And we also saw the discharges in Baptisia are highly offensive. Mucous membrane, you see ulcers, okay? Painless, sore throat. Can swallow liquids, can't swallow solids. Soreness muscles, they are all weak, they are all tired, but he feels the bed is hard, okay, and the delirium. We try to mix in everything, and we also try to compare arnica, restox, gelsemium, bryonia, and arsenic. Okay. Is it clear? Any confusion? Anything you would like to ask? See, if it's clear, we'll stop. Okay. And hopefully next class I have a small remedy like Baptisia, interesting remedy like Baptisia, which I'll take. With that, I'll be finishing my second year syllabus. Okay. Any questions? Chalo, if you have no questions, we'll stop. Thank you.